Welcome to FCC Knows. Welcome back, everyone, to FCC Knows. So what we're going to cover today are 3 common questions that a lot of people have when they come into therapy. So I want you to stay tuned.
All right, so the first question we're going to cover is how long does it take? A lot of times people come in and they may be going through really tragic situations, or they're just under a lot of stress, have a lot of anxiety, and so they want to know, like, how long is this going to take? And so what do y'all think? How do you usually answer that question?
For myself, usually I'll say therapy is a process. I don't want to give people a time frame because a lot of times, everyone has schedules, but it really depends on what someone's going through. So I like to break that down and bring up the idea that maybe you've dealt with trauma for years, which means you're not going to be able to get over that in 2 days or 3 sessions. So I like to set it up early so that people can be aware that, this is going to take some time. And if it's something I really want to invest in, which is myself, then I'll put the time in for it. So, yeah.
Yes, I would say the work that you're putting in directly relates to the time that it takes. Absolutely. And echoing, like, if a person has had like a lifetime of trauma, like developmental trauma, any type of trauma, like throughout young adulthood, then then that can take sometimes years, just depending.
I didn't mean to cut you off, but sometimes there's 2 things. Like, one thing, I do the same thing. Like, it just depends on what you're going through, who referred you, because sometimes whoever referred us or referred the person only has like a certain amount of sessions that they're financially or legally allowed to do. But we can always make extra requests. At least here we can. The other thing that I like to tell my clients, because you might come in with like depression or anxiety, but I always use this analogy of a storage unit. And I don't know, it's kind of weird because, at a storage unit, you pack away stuff and you leave it there, and then you're paying $60 a month and you forget that it's there, but you just make a payment and it's not really up front. You just know it's automatic. It's going to get paid. So I say to them that, well, you might be coming here for this, but we're going to unpack that storage unit and that's going to take time. And depending on what comes up for you, but I do think that people get concerned about how long it takes because they just think, oh, it's going to, like, I'll be done, because it's kind of like diabetes or something, though. This could be a lifelong thing for some people.
That's such a good point.
But you learn, I think that's a myth that, it's just like you get over it after a few sessions, but in reality, you just have to learn coping mechanisms.
Right. Yeah, and I think maybe some good questions to ask yourself are like, how severe is the trauma that you've been through, or the symptoms that you're having? If you haven't gone through any type of trauma, how severe are the symptoms? Have you ever had any therapy before, to go with your point? Like, if this is your first time doing therapy, I mean, it can take a while. Just number one, to get comfortable with the therapist. To find the right therapist. You may meet with one therapist and not really get that vibe and have to move on to somebody else, and that's okay. And so, how severe is the trauma? Is this your first time doing therapy? And, like, what... how long have you spent putting stuff in a storage unit and not thinking about it? It can take time to change those habits and those patterns, for sure. Yeah.
I'm glad you brought up that point, that about the therapist, because I know for me, for so long, I was going to therapy and I wasn't being honest, if that makes any sense. Like, I was just like, yep, and I'm not going to do this homework, but it was so good to see you today. I feel so much better. Bye. And then I just didn't have that connection. So I think that does matter too, about how long it could take, like you were saying, because if you're just not honest, you're not going to get that help that you need. So it could take longer, and you're going to blame the therapist, and it's not really the therapist. It's not really anybody's fault, because it is hard to just express all this stuff that's been inside of you to somebody that you may not know. And it takes time to build rapport too with a person. So
So it's kind of a trick question. Really, how long does it take? It's like,
Right.
It depends.
It just depends. Depends on the person, depends on their story, depends on, the work that they're doing. So, but it's always good to remember that, like Christy was saying beforehand, that investment that you're making into yourself is priceless.
Yes,
right.
And so while we might find a lot of different ways to deal with the crap that happens in our life, like coming to therapy and doing that is so valuable for that. So, yeah.
Do you have another question?
Yeah, another question that comes up a lot in therapy is in relation to, will people find out that you're here? A lot of times people worry about that because, of course, you're coming in with a lot of information, a lot of personal things. So that's a valid question. So, ladies, how do you handle that question if it comes up to you in the therapy room?
So I'm not originally from Columbus. I'm from Virginia, which was a much larger area. But when you come to Columbus, it's a very big, small town, is what I say to my clients. So the chances of us running into one another is usually a thing. So we cover that right out. That's really important to me, people's privacy and their confidentiality. And so usually, my answer is no one will need to know that you're here unless you want them to know that you're here. And if we were to see each other in the community, then again, that's totally up to you, but I don't usually engage. I don't engage my clients unless they were to engage me.
Right.
So yeah, the answer for me is no one has to know unless you want them to. So yeah, how about you, Anna?
I know here at our facility, that sounds so institutionalized, but at our agency, our receptionists always ask, do you want phone calls? Do you want mailings or anything like that? And a lot of people do say no. And so then I review that as well, like once they're up here, because I want them to know, like, the same thing. If we see each other out, don't, I'm not trying to be rude.
Right.
I won't, if I don't speak to you, because I don't want you to feel like you have to speak to me. Because then, especially if you're with somebody, because then that brings on the, well, who is that?
Right.
And you're just like, that was my therapist, but you don't want anybody to know that. So I kind of agree with you that it's who you want to know. When I was in the military, that was a really big question. So for any military people out there, that was always something that people was concerned about, just because if their higher ups or their supervisors would find out. So also something real quick, that with like military kind of referrals or something like that, there is that possibility that your chain of command will know. But something that I really love about our facility, our agency, is that you could self-pay, so you don't even have to use your insurance, because sometimes with insurance you have to, the insurance people will know, but you could self-pay, and we make it really affordable. So I'm sure there's other places that have a sliding scale fee is what it's called. Yeah. So it's really just up to you. Who knows? Because we don't have to tell anybody, really.
Yeah.
Right.
Yeah. And that's like a great point. So our sliding scale fee for us personally is anywhere from $15 to $75. And so if you're out there and maybe you're not local, but you're wondering, like, I really do want to pursue some counseling, but it's so expensive. You can look for those places that can offer you that sliding fee scale, and also insurance. So that's a whole other thing, but there is a possibility of people taking your insurance if you wanted to go that route. And in that case, Christy, you can probably speak to this the most, like if folks have to find out if you're using insurance.
Honestly, a lot of times big companies will have what they call an EAP, which is someone that they allow to kind of assist their mental health concerns without it being directly tied to their organization. So all the information then goes through that instead of having to go directly to the supervisor of your company, which still gives you your privacy, and it also still gives you the chance to receive some services when they're needed. So you don't have to, because again, it still is up to you, and you get to share with us when coming in here if it's somebody you want us to talk to, and we would then get that permission from you and move forward. But like the lady shared, if I see you out and about, I don't want to be mean either. I'm not going to go up and say, hey girl. So I'm not going to do that, because I want you to be able to maintain your privacy. So we do make sure to keep that sacred. So yeah.
And something I just recently found out, because I was helping one of my clients, because she just finished up and she's was looking for another agency because she's moving away. is our supervisor, Rachel. Shout out, Rachel. She said that because we're a United Way community partner, that people could just contact United Way and find another agency, because most of the agencies that they partner with are like ours to help with like low income or just help with a discounted fees in general for things, or even like you could find a free services if you had like a sexual assault or domestic violence or something like that. So they can connect you to a community partner, and then those fees would probably be reduced as well. So
So for our last question, are we ready to move on to that?
Yeah,
I think
yeah.
cover everything there. Okay, cool.
So the one that we came up with too was, can you even help me? Like, so people are concerned usually about, I guess, your credentialing.
Right.
So can you even help me? Or that their problem is so severe that they feel like nobody can help them because they're probably in a hopeless kind of state. So what do you tell them if they ask you, can you even help me?
So there's been a couple of different times when I've received that question, and it's always like jarring, right? Because you're like, yes, I think I can help you, but no, like, so a lot of times that question comes out of a space of like, we're so different. Just to name a couple of things, like, so I'm a woman, and so working with a man, or if someone is of a different gender identity than me, then what does that mean? Can I help that person? And if, we haven't had the same experiences, so, I personally haven't been in any type of war, and so can I help someone who's been through that? And the answer is yes. Like, I think like we can help, but not because we've necessarily been through the same thing, but because a lot of times working through trauma is about people witnessing your story. Like, it's about people offering you that safe space to be able to process and validating those feelings, and even just the validation. Our culture doesn't necessarily make a lot of space for you to deal with your anger, to deal with grief, and we always want to hurry it along. And so yeah, usually, yes, like, I can help, but it may not be that we've been through the same experiences. Yeah.
I agree. I think a lot of times I'll tell clients that, true, I feel I can help, but again, I go back to the idea that this is your journey. So I really make sure to highlight for them, you have to be able to go on this journey with me and share with me what it is you need. Because if things aren't going well for you, I want you to be able to say, Christy, this isn't helping. Can we try something different? And then we can start to change that journey. And also here at the Family Center, the good part is we do have like a little survey that people get to fill out. And I really use it because I look back, if I see that it's low, I'm like, okay, something's not going right. And then I like to check in with them periodically just to make sure, do you feel you're getting what you need? Do you feel that you are in need of some things in the community, some support groups, some things like that? So I agree, we can help, but I do think at the end of the day, when you come in, you have to ask yourself, where am I in this journey? And what am I really looking for at this time? Because we have to meet you where you are. So we can have a lot of ideas about different things that may work, but you have to know where you are in that process so that we can meet you there and help you to see the rest of the way. So,
Absolutely. Yeah.
I think it's really important to, like what you mentioned about validating. A lot of times too, especially in school, like you learn, have empathy and validate. And I think really you don't have to have gone through that same experience, because you're going to experience it differently anyway. But the thing is like you said, meeting people where they are, and also just listening and being non-judgmental. Because I think when we talk to our friends or our family or something, then they're judging you. But when you go to this new person, they're not judging you. And sometimes people do feel like, well, you're going to judge me. And then they get concerned about like really sharing. But I always try to re-comfort them and let them know, I'm not judging you. I can't judge you.
Exactly.
I really can't. So I try to make them feel as comfortable as I can. And like, I think in another segment we'll cover like kind of like treatment planning, but that's kind of like in having goals. And so just as long as we set those goals, meet you where you are, and do it all together, you're not alone. So because I know unpacking that storage unit is really hard to do by yourself, and then especially if you, even if you have a family friend or something, then they're helping you unpack it, but they're just the whole time, girl, why you got all this, man, why you did, you know, and they're just piling on the, you know, and they're just not making it any better. But when you can, you know, have somebody help you unpack it, and it's just like, you don't really need this, you've been holding on to this bag for 20 years, let that go, you know, and then help you to let it go, not just, you know, by teaching you the skills. So it's all about, I think, just you gotta want it, and we can help guide you with those things, or bring up thoughts that you hadn't really thought about. So that's the way I see getting help.
Yeah, and to piggyback off of that too, you know, when people ask that question, can you help me? If the underlying question is, can you make this go away?
Can you fix it?
Like, no.
Exactly.
No. Yeah, and so my answer to that is like, you know, what are your expectations? Like, you really have to evaluate like what your expectations are coming into therapy, because there's so many misconceptions, and I think we'll cover that probably deeper in another time. But yeah, just so can you help me? Absolutely. Can you fix me? No.
Right.
And I think that is it. People come in like, I want to be healed. Like, you can go get radiation treatment and then your cancer goes away, you know, for you know, in hopes of like that. But I wish we had a little.
I always say that. I wish I had a magic wand.
I would be like Oprah. I'd be like, you get a good healthy mind. You get a good healthy mind. But you know, but unfortunately, it's not that simple. But I wish it was.
But all of that's based in, you know, for me, that I believe everybody has the ability to find that within themselves. It's just about us as therapists being able to like. Help them find those things within them to do that.
Yeah, it goes back to that empowering piece, because a lot of times I think people get the notion, like you said, friends and family may help, but it's a space where sometimes friends and family can make it a little bit harder. Right. So you have to deal with what your issues are, plus what people are telling you is wrong, and then that just kind of leaves you in a funk to say that, man, can I really get through this stuff on my own? So I need somebody to fix it. So I think that's why people come in and say, can you fix it? So the great part is we get a chance to help facilitate that empowering feeling of saying, wow, I can do this. And it's great to see that process when people actually start to realize they can do it.
I agree, 100%. Yeah.
So if you have any questions that you want to know, comment below and just ask us, and maybe we can answer them. Maybe not a full video about it, but you know, we can just address it at some point. You know, so please engage with us, and we'll comment back. Don't forget to comment, like, and subscribe. Thanks for watching. Bye. See you next time.